Welcome to this episode of Thrive with Us. Today we're talking about couple therapy, which is one of the most requested forms of support. I'm joined by Juan Korkie, licensed clinical psychologist who has been with us at Thrive since November 2025. Juan works with individuals and largely couples, and so today we wanted to break down what exactly couple therapy is, what it looks like, how it works, when you need it, and when it might be too late. Welcome, Juan.
Thank you.
So we were talking for a little while about what we might cover in today's episode, and you suggested an overview of couple therapy because it seems like a lot of people understand what it might look like, but probably have some misconceptions. What are you noticing in the therapy space?
I think there are often a lot of misconceptions about couple therapy. I think the thing that's, if there was a message to put out there, I think the most important message is do it earlier.
Yes.
Because it's so common and it's part of the work. People end up with us for couple therapy usually when things have progressed to a really negative space. Sometimes it's because something has happened, there's been some sort of breach, but very often it's just things have been accumulating for years, 5 years, 10 years, 15 years, and of course that will always happen. But if there was a wish list, it would be for people to just do it earlier. Don't wait for it to become critical. Do it as a checkup. That will be healthy. So
Yeah, absolutely. I totally agree. And I think there is this statistic floating around out there by the Gottmans. I don't know if you've heard it, about 6 years too late for people usually to seek couple therapy for the first time. Whether or not that's perfectly accurate, I think the point is exactly what you said. A lot of people sort of wait until there is a critical incident, or maybe they've tried so many things, feel like they've hit rock bottom, and the process almost becomes a last-ditch effort rather than something that is more preventative or promoting healthier relationship patterns.
Yeah. I mean, the 6 years makes sense, but also all these major transitions. We know that, people get married or a couple of years when they have their first child, there's a crisis. It's not, all the beautiful stuff about having a new baby, but then something happens in the relationship because it actually stops being the same relationship. That's one of the first times already. So in terms of 6 years, this is usually, depending on when people start having families, very early on. That's the time to say, hold on, pause. Who we are has actually fundamentally changed. Positive, but also a change. So, yeah.
Who we are as individuals and then who we are as a partnership, it becomes completely transformed when you become parents.
Yeah. That whole exclusivity, the whole we are everything to each other, suddenly there's a third person. It does change it completely.
That's a difficult transition. What are some other difficult transitions that can put a strain on a relationship?
I think life. I mean, yes, of course, the big ones are things like early on when people start having a family, when they move house, when they move country, what they used to do. Maybe in the beginning of the relationship, both were working. Now the relationship have shifted towards maybe one person taking care of the child or being more at home, taking care of the household, the other. That's a shift in who we are. It's also a shift in what we bring, what we have available resource-wise, but also where we are anchored. I think those transitions across the life cycle of any adult, all of those put strains on the relationship, and very often it's not addressed because we really loved each other when we were in our 20s. 20 years down the line, we are not the same person.
No,
and I think it's Salvador Minuchin who said every 7 years it's fundamentally a new relationship, and you almost have to redo the vows. But what it's really about is the agreement of who are we in this relationship and what are our roles. I think this is a big thing, the roles we fulfill.
yes.
I may have been happy to fulfill a certain role in my late 20s, but in my 40s, maybe I want that role to change. And I think that ability of a couple to have a conversation, a relationship conversation, and renegotiate, very often it doesn't happen. And that's just one source of friction over time.
Yes, and I think what I've observed personally and professionally is that one of the roles that can create some friction, in addition to parenthood, is employment status, whether that's working outside of the home, but then also, as you were referencing a moment ago, the division of domestic responsibilities and what's happening inside of the home. Is that something that you've seen, that work puts pressure on relationships and families?
Definitely. I call it the partnership arrangement.
Okay.
So if a relationship, if you think of it as a landscape where it has different aspects, one of them is the partnership. And very often it's not explicitly discussed, and it changes. Like what I just said, where we start off and how it changes. Maybe, a traditional role of a mother that over time, where's your place of thriving as an individual, of maybe your career, maybe you want to go back to, and that requires the other person to adjust and change. Who does what? People coming from different cultural backgrounds, personal backgrounds, our expectations of what I am and what you are, those are really important aspects that need to be discussed.
Yes, absolutely. Relationships are very complicated, but at the same time, they're a core part of our humanity.
Yeah.
And it sounds like from what you're sharing that there are a lot of moments in the trajectory of a relationship where people might seek support. So why don't we break down actually and define what couple therapy is for our audience? What is it? What does it look like? How does it work?
So couple therapy is, maybe we should define who's the client.
Okay, that's a good start.
In couple therapy, because it's something I often say to couples where I go, it may have been the wife, it may have been the husband who made the appointment, and I go out of my way to say, you are not my client. Just because you paid the bill, just because your name's on the file, you are not the client. The relationship is my client.
Yes.
And I think this is a big adjustment in if you're used to an individual therapy frame. The client for me is the relationship. And couple therapy can only work if both people agree on the therapy doing the same thing. And that sort of unspoken contract is actually about we are both at a place where we are willing to work on our relationship. My job as a couple therapist is to help the relationship to change. Which in one part of that is to nudge the relationship for things that don't work, for that to be interrupted, to be disrupted. Sometimes that can be quite provocative as an experience, but also to replace the things that have become lost, because that's what happens over the course of a relationship. The things that actually keep the relationship healthy drops off. We don't have to, remember to tell the other person we value them. We have to pay the bills.
Yes.
We have to get the kids' dinner sorted out, and it's a lot. So the relationship over time. That relationship, which is the focus of couple therapy, becomes stuck in who does what, and it's that pattern becomes so repetitive. And couple therapy is about focusing on that pattern and getting it unstuck. And there are different ways in which that gets done. So I think the essence is very different from individual therapy. And sometimes people come to couple therapy, understandably, the very common is someone brings someone to couple therapy. And very often the challenge for them is to hear, no, I'm not going to help you to change your partner.
Yes.
I'm going to help both of you to be different. And that can be uncomfortable.
Yes, absolutely. So what I'm hearing from you is that the priority in a couple therapy context is the relationship. And that kind of reminds me of one of the misconceptions I hear all the time, which is that a couples therapist is there to mediate. So a couple will come in, husband and wife, each of them will plead their case, and our role is to say, she was right, or he's right, you should listen to him. Is that what we do?
No.
No, not at all.
Yes, you're completely right. Very often that's the invitation. The invitation is, tell me I'm right.
Exactly.
Or more specifically, tell them I'm right. Tell
Exactly.
them they're wrong. And it is not that.
No.
Because the frame that is required for couple therapy to be successful is both individuals have to assume, and I say this quite explicitly, you have both done and not done things to bring the relationship to where it is. It's not always 50-50. And it's not always the overt actions, the things that were said. It may be the withdrawal, that may be not taking space, it may be leaving the room. A whole range of ways in which both people have contributed to the relationship as it is. And for me, when I work with couples, both individuals being able to accept that is very telling of whether the couple therapy is successful, because it's actually the first challenge. I come in because very often I bring my husband, not always, but very often. And now I hear, but I'm going to have to look at things as well. We're both going to. And if both people cannot do it, it's not going to go anywhere.
No, it's not going to go anywhere. Both people do have to recognize that there are multiple inputs into the relationship, as you were saying, things that have been done actively, things that maybe were withdrawn over the period of time. And in some ways, I think that provides us with a lot of material to work with. If both people have contributed in multiple ways, and there are multiple pathways to rewire the trajectory of that relationship.
Yeah, it's very much that. And it's a way of, it's about sharing the blame, sharing the ownership, because couple therapy is not, like, to come back to your earlier point, it's not about saying who's right. It's basically saying, let's assume you're both right and you're both wrong. And this is important because it's saying, in relationships, we end up doing things as a way of survival, as a way of coping, because this is what we grew up with. This is our blueprint. But it doesn't work. And over the course of the relationship, those ways in which we try to solve the problems, they become the problem. So the very way in which a couple almost presents with, this is the issue, is usually part of the problem. And this is why that sort of initial discomfort is saying, no, it's it's something else. We have to literally zoom out and say, how have both of you become stuck? So it may be challenging, but it's actually sort of gets rid of a scapegoat from the start.
Yes, no, definitely. That makes a lot of sense. And so we said that at the beginning of the process, a lot of times what will happen is one person will really initiate and be driving the process. And a lot of times that person wants us as the therapist to fix the partner, tell the partner that they're wrong and this person is correct. And a lot of what needs to happen at the beginning is really laying the groundwork on what the process is and the fact that both people have shared blame and shared responsibility. Do you ever get the sense, even when one person enters the room and is attending physically the session, that they're not really bought into the process? And then what kind of happens from there?
Of course, it happens very often. There are many ways in which two people walk in, but one person isn't there. And because the way in which people end up in couple therapy is connected with at what stage they come. And usually, the further down the line the relationship has gone, it sometimes is a way of saying, I'm going to use this to show why I've been right and you've been wrong. It can be my way of saying, well, I'm doing this as the effort, but I'm actually on my way out.
Yes.
And it may be this notion of, which I also find very common, I've been in individual therapy, I've done my work, now it's your turn. And all of that doesn't work. So is it common that people walk in and they're not on the same page? Yes. And I think that's, for me, an important part of the work is to make sure, are you both actually here to work on the relationship? Because if one person is already exited, because you can exit without leaving.
Yes, you can.
You can check out, then it doesn't work. Because you're not there anymore. We can't do the work. So it's very important.
What are some signs that both people are really there to do the work?
I'll say the word that pops into my mind with this: shame.
Okay.
And what I mean is, you can hear it. The willingness for each person to say, this isn't working, I'm not happy, I'm sure there's stuff I've done wrong. And I say shame because it's sort of this, a bad word sometimes, but it's so important. The more I do this work, the more I realize shame is the best indicator of people being willing to do the work. If both people can take ownership, I'm not talking about being shamed. I'm talking about just, I know I've messed up. I know I wasn't there. I know I said things that were hurtful. If both people can connect with that, for me, that's a very, very important indicator, because that's what's required for the work.
Yes.
Ownership.
Yes, of course. Exactly. That's what you were saying before. So it's not about shaming ourselves or shaming the other person, but it's about recognizing what those inputs are, being accountable, and being willing to name them and hopefully work towards a different way of being.
Absolutely. The whole process of repair, which has a lot of different components to it, is about being able to say, this is what I've done to you. This is what I've done. Not because I'm bad, not because my intentions were bad. I know I wasn't there. I know I did things. That's it. It's a very big step.
I'm wondering as well, you were saying before that many people that present for couple therapy have one partner that maybe has undergone or is undergoing an individual process and thinks, you know, it's time for me to bring my partner into this space. A couple of things come up for me in relation to that. One of them is there are some people that wish they could attend couples therapy, but their partner is incredibly resistant, possibly even outright refusing. What would be the recommendation at that point? Would individual therapy be helpful for a relational problem?
It's tricky. If the starting point is this has been suggested but they refuse, which actually you hear very often, what I would explore is how it was suggested. Because if my wife comes home and say, my therapist wants to see you as well, I'm going to go, no, it's not happening. What have you said? And I think this is important. This is what gets missed, is if the other person already had the ear of the therapist, have already sort of, laid the groundwork, that is usually not the groundwork, it's their experience. The other person is much less likely to engage. And I find this. I find couples saying, can I just give you an update first? I'm like, no, thank you. I don't want the update. I also don't want to see you first. Not because for me, but I know that the moment I've seen you, already your partner is entering that space with what has been said about me. How has this sort of groundwork been laid? And that's why for me, in terms of starting the process, it always starts with both people. Both people walk in, we'll manage it. Both people need to say what's going on for them. And it feels fair. It's easier to engage.
Yes.
But to come back to, I think the question is, if someone is trying, so I think part of what I'm saying is, it's important how it's said. If I said, I want you to come and this is why, because I'm trying to change you. If that is the message any person heard, of course they're not going to want to engage. That doesn't mean that there are people who will still refuse, no matter how nicely and how gently and how from a place of, I want to work on this, that people won't engage. And will individual therapy be useful if they will engage? Potentially. Couple therapy is not a magic wand.
No.
It requires two people. I think the thing that gets lost is that transition into couple therapy and trying to start off at different points, trying to sort of lay the groundwork, trying to, make sure the therapist knows all the important details from one person's perspective. That never works.
No.
But sometimes people don't want to do the work.
No, definitely. So what I'm hearing from you is that one of the things that you will explore in a scenario like that is what was said, and then, well, you actually said what was heard. And I think that that's a really important distinction because sometimes we can say something, but if it's being heard or received in a different way, perhaps we put the request for therapy in the aftermath of a fight.
Yes.
Probably it's going to land differently. Exactly. It's going to land differently than if it's at a more neutral time. So individual therapy can be useful if someone is buying in. And when I was asking about, is individual therapy a good alternative? I meant for the person that wants couples therapy. So let's say I want my partner to go to couples therapy. He refuses, thinks it's a bunch of baloney, hocus pocus, whatever it is, will I be able to get what I need, even to an extent, out of my own individual therapy process?
Of course, that can happen. That's not. If that's the situation, yes, then you don't really have a lot of options either.
Yes.
But yes, of course, individual therapy can help the process.
Mm-hmm.
If nothing else, to decide where you're at. And
Yeah.
if everything has been tried, then, potentially that's about considering, how do I move forward with this relationship? Because there isn't a magic world where all relationships work out. It doesn't happen. It's not real.
No.
And of course you can do that, and individual therapy can be very, very useful. My concern is what I sometimes get is people say, we're not going to start with couple therapy. I'm going to start my individual therapy. He's going to start, or she's going to start her individual therapy, and then we will come. But the critical, urgent issue is the relationship. And every month means more damage, what I call the legacy of injury. It means it's just accumulating. So if someone comes to me for individual therapy and I hear that everything we are discussing is about this relationship, I will always try to get the other person to come in. And then it's my invitation. I will say, ask if you're okay, can your partner come in? And I will even say, well, maybe I'll see them individually as well to balance the scales. Because the work is relational. But yes, if the partner says, no way, I'm not doing it, then it is individual therapy.
One of the things you touched on a moment ago is this idea of not all relationships work out. And so one of the things that people can come to therapy for as a couple is to figure out, being at that crossroads and doing the discernment therapy. We're in this relationship. We've been in this relationship for X number of years. This is our situation. And one or both of us is unsure about the way forward. Is that something that you see often?
Yes, because most people come too late. And usually they come because at least one person is talking about exit, right? In some shape or form. The talk about divorce, separation has increased. One person is on their way out. And that's often the push, unfortunately, that takes people to come in. To be in couple therapy, you don't have to commit to the future. You just have to commit to the work. For me, that's an important distinction. If a couple comes in and one or both of them feel, I'm at the end, that's okay. But I explained, this journey, this process is going to take this amount of time. You don't have to promise the future. You just have to decide if you're willing to commit for a set period of time to do the work. And in that time, you have to stay in the relationship. I'm not talking about legally staying in the relationship.
Yes.
I'm talking about you have to be present.
Yes.
So not being outside. And that's really important. And then, yes, you can get to the point after 3-4 months where people just decide, one person or both, like this isn't working.
No.
That's okay. And I think this is also important in terms of people coming to couple therapy. I'm not invested in making relationships or marriages work. I'm not invested in making them break up. And this may sound a bit harsh. I don't care. It's not my life. But if two people are there, I can only work with them if I can clearly see both want to do the work, even if it's short term. If they decide to go either way, that's their decision. I respect that.
Yes, and I think this, again, like you were saying, is a major misconception that people have, that as therapists, the role is either to push towards staying in a relationship regardless of what that relationship looks like, or that some people might be, quote unquote, pro-divorce. I've heard that. What I'm hearing from you, and what I think is pretty standard across the board, is our role is to help our clients get to where they want to get to. And they might enter the room the first time with one objective in mind. And as they commit to that process, engage, show up, that might pivot. It might go in a different direction. And our job is to pivot with them.
Absolutely. We don't have a mandate to save marriages or to break them up. I find it strange because obviously sometimes people come in and say, but we have seen someone else and they told us there's no hope. I don't understand that.
Me neither.
when I start with couple therapy, I do this sort of overview of the landscape of the relationship, all the different aspects, conversation, intimacy, partnership that we talked about, all the different components. And people will sometimes ask me, so is there hope? I'm like, I have seen couples where every single aspect of the relationship was deeply compromised, and they found a way. And I've seen couples where they've seemed more or less okay, and they did not. It's about the willingness to do the work. Because couple therapy is not something I do to people. You don't turn up, sign I've got my 10 sessions. It's not it's not a course.
No.
And the work is, you have to do the work in the session, and like you both have to be present. And you have to do, and I know different approaches work differently, but I do I use a lot of homework assignments from the second session. There's stuff you need to do at home. And if the first week you come back, and you didn't do the homework, that's fine. The third week, I'll tell you, this is not going to go anywhere. You're not doing the work. Whether it's one or both, if you're not doing the work, I can guarantee you the process will not work. But yeah, we're not purveyors of hope.
No, and we're not able to do the work. We're able to facilitate the process, guide people, as you mentioned before, helping identify, disrupt, disturb, all of these things that are required in terms of what you see in that space. But ultimately, everyone is responsible for showing up and doing the work. And couple therapy is only really effective when there is that buy-in, people are motivated, and they're committed. And, you were saying it's not a course. It's like you can't sign up for personal training, and just go and sit on the equipment and expect that because I went to the gym for an hour and just sat there surrounded by weights, that magically I'm going to have the summer body that I wanted in 6 months. You got to do the lifting.
I was doing something wrong. No, it's not. It's not a passive process.
No.
I remember one person once asked me, "What's your success rate?" And I said, "I don't have a success rate. It really is about whether you do the work. If you think it's whether I'm going to do something, no, that's not going to work. It is hard work. And I think this is something, and it's not about overselling, but it is hard work. It's a river. I always think of, these rivers in a canyon. It's formed its path over thousands of years. The couple has a path, and they've shaped that way of being together over thousands and thousands of hours. You want to change the path of the river. Do you really think 1 or 2 hours is going to do that? And that's why there's an element of the work that needs to nudge. And that is difficult. But that doesn't mean it's just that. It's also a part of soothing, of replacing the parts in the relationship that makes it worthwhile, that makes it feel soft, that makes us, the couple, remember, hold on, this feels a bit nicer, a little bit softer, a little bit warmer. That's also very important. The other bit is the very visible bit, but it's very important to make the relationship worth fighting for. And that's also what the homework is about, to reinsert those elements. And that's usually where the homework actually starts. It's not challenging things. It's actually reconnecting with the things that feels okay.
One of the pieces of resistance that will come up for me, because I've also used homework, and similar to, I think, what you're describing, trying to reconnect people through rituals, trying to reintroduce a little bit of playfulness, connecting with our inner child, and all of these sorts of things, because fun often goes out the window when our relationship is not in the best place. Sometimes there are scripts that can be involved, and I've often heard, this is so robotic. And usually what I say is, well, it's different, and anything that is different feels unnatural. It's not about having to say things exactly in this way or do things exactly in this way. This is a model. You can make it your own, but over time things feel a little bit more natural. And as you were saying a moment ago, can remind you that this relationship is worth fighting for, help you reconnect with that sense of the relationship and that part of you that maybe has been lost. Do you encounter that as well? Resistance to the the homework, and this feels unnatural, and it should be spontaneous, and it should be happening organically.
I love that. It's the myth, the spontaneity myth. And it, because of course it's awkward, of course it's weird, of course it's not natural. The problem is where the relationship ended up is a natural drift. The process of therapy is to shift that, and that's the awkward exercise, the structure, whatever you use. It's a scaffolding.
Yes.
It's the training wheels. No one goes, I'm going to be using training wheels for the rest of my life. No, but if you don't want to fall over, you're going to use training wheels. And that's really what it is. I know probably the most scripted process I use is called a repair sequence, and it's sort of later stage therapy. And it's literally a process where people separate between the speaker role, the listener role. It has 5 steps. It's not scripted in terms of what you say, but it slows the conversation down. And I introduce and saying, this is weird and unnatural, and no human being talks like that.
Yeah.
Right? It's supposed to be like. But what the purpose is, this is the scaffolding, it's to prevent the escalation of the conversation. Because for me, the essence, the heart of a relationship is conversation. That's really what I'm doing with couple therapy. How to recreate conversations where they actually don't spiral, where they actually can lead to a sense of warmth, a sense of intimacy, a sense of connection, and repair. But yes, lots of structure is needed. You're going to have to do weird, awkward exercises, but it's just training wheels. It's very important, though.
Yeah. I think one of the things we've talked about quite a bit is that it is a process. It requires a lot of engagement, a lot of effort in the session as well as outside of the session. And I can imagine that maybe some people that are listening to this conversation are feeling a little bit intimidated about engaging or having their partner show up in this process. And this is what we need for it to be successful. But just like with anything, I think the first step is the hardest. And it's important if you feel like something either A, isn't quite right, or B, starting to move in a direction that looks problematic, that's the time that you reach out and you explore. And the couples therapy process, yes, it can be very streamlined, but it's also customized to the needs of that client. So even though there is homework in the approach that you use and the approach that I use, it's something that is decided upon. And if that couple, that client, isn't really comfortable with that approach, then we can also either refine our approach or help them find someone that's more in line with the approach that they're looking for. So we want people to know that, it's not that you have to sign up for this process forever, because I think that's a big part of some people's reluctance to engage. It's draining, emotionally draining. It does take time. It is expensive. Just take the first step, try, see what you can do, and just show up as best as you can.
I think you're touching on a lot of very important things there. Even the way I speak here, not every couple therapist works like I do. Everyone has a different approach. I know I am more structured. I am more direct. I know therapists that are on the other side of the spectrum, and it's differences. And one of the things I say to a couple is, after the first session, you only have to make one decision, which is, am I the right therapist? Because you've now heard me, you've seen me, you've seen my sense of humor or the strangeness of it. You get a sense of me. Do you want to work with me? Yes. And if you say, listen, we don't, that's okay. That is really part of the field. The finding the right fit is completely okay. And I think that it's I don't know, something else that you've said there I want to touch on is, for me also, couple therapy is not, it's not a long-term process. I don't see couples for years. For me, it's a much shorter, more higher intensity process. But at that point, things need to start changing. And I know everyone works differently, and that's okay. But it's not signing up for 10 years of couple therapy. Like it's a short term, relatively, maybe shorter than most forms of individual therapy, and it's okay to have a pause. It's okay to get on with your life. For me, the outcome of therapy is to get to the couple therapy is to get to the point where you can have conversations, you can have relationship conversations, and you can reinsert those aspects of the relationship that makes it worthwhile, where you can go through the process of repair. That's sort of when a couple gets to the place when they come in and they say, we had we had an argument, we were able to repair, those arguments have decreased, we generally feel connected, wanted, liked. That's the outcome we're looking for. Not
Yes.
a perfect relationship, one that keeps that keeps the warmth, that keeps being something we want to be in. That's the outcome of couple therapy for me.
And ultimately, what happens is the therapist makes themselves redundant, right?
Absolutely.
Over time, people learn the skills, they modify the language, all of the techniques and behavioral activations and homeworks that are given become kind of part of their normal repertoire. And it might be more time between sessions until the point that they don't really need us anymore. And that is amazing, right?
Absolutely.
That's what we're working for.
It's exactly what you say. We make ourselves redundant. That's couple therapy. Getting to a place where you don't need it, and very often the end stage of couple therapy is exactly what you're describing. The beginning, if we want to pick up momentum, we need to meet once a week.
Yes.
We can't have a session every time there's a crisis or an argument. Then it doesn't work.
No.
But the end state is, okay, you come back after a month. Were there arguments? Yes. Did you resolve them? Did they escalate? No. Could you do the repair? Are you doing all the other things that make the other person feel seen, wanted, listened to? That's good. Keep going. Come back in a month, 2 months.
And, between the first part that you described and the end of the process, there's a lot of variation in what can happen. People might still have conflicts that really, really escalate. However, they recognize that happened and what their input was to that. Earlier on, they can take accountability. Later on in the process, they might become more aware of the warning signs that they're about to get there, that they're about to go low, that they're about to do the thing that they do that adds, fuel to the fire, and stop it. So it is a gradual process, but it also is one that can be a few steps forward and a few steps back. It's not completely linear.
No, definitely not. And very often couples come in and they want to start, they usually want to dive into the painful stuff, the history, the horror. And we're not doing that. We first want to establish a way in which you can have a conversation. The time you come to couple therapy, usually that's what's compromised. The ability to talk about the relationship isn't there, to have a relational conversation about the relationship. And the ability to have a disagreement process or a conflict process that doesn't spiral. Once that gets softened, then we can start looking at the legacy stuff, the old stuff that happened 10 years ago or whatever, or the big breaches. And then everything starts softening. But it's not... Sometimes we have a massive setback, and that's sort of part of the process.
And I think another misconception that people have about therapy in general, but especially couple therapy, is that you're always going to feel better when you walk out of the room. Sometimes you feel much worse, and that's okay.
Yeah, I think that's so important, actually, that you say that. I know I say that to couples for the first session. I'm like, you're going to walk out of here, nothing's going to be different. This session is for me to understand your relationship. So nothing's going to change. First couple of sessions, because there is no magic wand. And I think that's the one part. The other part is some of those sessions are going to make you feel worse, because you're going to have to connect with some of the difficult stuff. You're going to have to start saying those things. You're going to have to sit with it. And that's really important. It's definitely a process where, especially in the early stages, the intensity, the discomfort, the unpleasantness, the pain increases, or it feels like it. Because we're talking about it. So you're very right. It's not that, couple therapy soothes it. We can only change things, and that opens it up. That means both people have to sit with the intensity, and difficult things have to be said and heard.
And so, in terms of the initial stages of the process, you said, and I do the same, that people should present together. That just helps have a level playing field and not have to do what you said before, which is try to undo whatever it is that the person who didn't attend the first session is feeling. So it starts with both. Do you do individual interviews as part of your process as well?
I know over time I've used different approaches. I know some people do it in the beginning. I used to actually do it very early on. I don't always do it early on. Honestly, the more I see what I call blueprints coming up, stuff for each or either individual's background that shapes some of the way they make sense and experience things, I will sometimes say, okay, I think we need to do the individuals. And for me, what that looks like is sometimes spending an hour with each person individually. But what I've done more and more is I actually do it with the other person present, because it's a way of the other person actually developing some understanding of what is playing out. Because when I hear what my partner's upbringing and childhood experiences, how it shapes how they see me, it actually builds empathy. So I use different approaches. Sometimes that never happens, but for some couples, yes. But if I do it, generally I will spend time with each person, but not always. But I know other people do it earlier. I guess it's just a different approach.
Yeah, some people do it, and as you said, do it earlier. Sometimes there can be an occasion in some methods to do it further along the process. But I think a couple of things that are important is that, it's relatively equal, right? And also so that when you're meeting with an individual, they understand that you're not going to be keeping any secrets. So that's not the time where they come and drop the bomb of, actually, I'm in this long-term affair and I'm only here because he or she forced me to be here, or similar, because that can happen. So laying the groundwork from the beginning that the couple is my client, which means anything that is affecting the couple needs to be transparently out on the table for me to be able to do what I need to do to help you do the work.
Absolutely. Yeah, there are no secrets. You can't have secrets. I'm saying no couple therapist can hold those secrets.
No.
Definitely not. It doesn't work. There's another variation, though, which might be useful to say here. Sometimes in the course of doing the work, couple therapy is reactive. Actually, all therapy is reactive in the sense that the process leads to an increase of emotional intensity. More things surfacing, emotions, but that's what I mean with intensity. Couple therapy, maybe more so. And sometimes what is sort of shown is one person really struggles to stay regulated. That happens. That's not that uncommon, more so than the other person. And sometimes what is needed is to support that person, sort of shoring up, how to help them to just stay present in the process. And sometimes, and this is where therapists are different, whether they will do it with that person or whether they will refer out. And that may go as far as referring to psychiatry. I personally am happy, but the other person will know. I will say, this is what I'm seeing. This doesn't blame that person. This doesn't mean everything in the relationship is your fault because you're getting upset.
No.
It just means shoring up to help you. The other person may know, but I know therapists do it in different ways, and that's okay. But I think it's important to understand the therapy process itself can trigger one person more in terms of their ability to stay in the conversation, and then some additional support may be needed, whichever way it's done.
Absolutely. And, you were saying earlier that a big outcome of the decision ultimately after the first session is this the right therapist for me? Yes. So in that first session, yes, there's a little bit of, why are you here? What brings you to therapy? What would you like to be different? a little bit of some of the history taking, but ultimately it's about you as a therapist ensuring that this is a couple that is within your scope of competence and someone that you feel comfortable working with. And importantly, that both partners in that relationship feel that this person is someone that either gets me or can get me, and I feel comfortable with him or her, and I will be willing to kind of put things on the table. I will be willing to take direction. I will be willing to be supported by them. And it's okay. Not everyone is a fit for everyone. And if you end up having a session and think, oh, no, like he or she gave me the ick. They said something that I really didn't like. Or sometimes it can even be something as seemingly simple as, well, he or she reminds me of someone really unpleasant from my past. Don't go back. Don't go back. You need to go and find another person who can assist or support. It's not about forcing yourself to stay with someone that you don't have a good feeling about, but that's very different than when you're engaged in a process and the couple therapist gives you feedback that you don't like.
Yes, two different things. But yes, I think it's important to normalize in the beginning. If you feel this is not going to work, that's okay. It's really okay to say, listen, this I ask couple, I say to couples, you're going to have to make this decision. You don't have to tell me. Go home, decide on your own. Don't pressure each other. If you commit, then you have to commit to the process. And I think this is the nuance you're talking about, which is the side about if you step into the process, you have to trust the process, because I'm going to, at times, move you away from certain things. I'm going to interrupt certain types of conversations. I'm going to, at times, focus more on one person than the other person in the process. So the decision is trust the process. But in the beginning, if you feel this isn't a fit, of course, don't. That's really okay.
So in conclusion, when it comes to couple therapy, it's something that people tend to seek when it's almost too late. Our advice to them would be come as early as possible. Preventatively is better than kind of a late intervention. Transitions can be periods that kind of bring to the surface difficulties as well as breaches of trust and other crises in a relationship. The process begins with a joint session. Sometimes individual interviews as well as individual processes might be indicated, but ultimately what we want to do the first time that we meet with a couple therapist is to kind of give a little bit of an overview of who we are and why we're here, where we want to go, but also really vet, is this the person that I can trust to engage in this process with and that I feel comfortable with? And then you just got to be all in as much as you can and know that it's going to be difficult. It's going to be unpleasant at times. It's also, if it works, going to be really worth it, because I think ultimately, not striving for a relationship to be perfect and to go back to those honeymoon days or anything like that, but just having a relationship that feels meaningful and, you said earlier, is worth fighting for. I think that is ultimately the best that we can do, and that is a really beautiful thing to have.
Yeah. I think relationships are the biggest challenge of being human. The one thing we all have to do. It doesn't matter what we do as a job. It's the biggest challenge, and it can be challenging, but it's always about the thing that makes it worth it, because that's really what it's about.
Thank you so much for all of your insights today. It was a pleasure to have you.
Thanks for having me.